Invitation. It is short notice, and I've just come back from overseas. It's great to be here and to be able to maybe 10 minutes. What I thought I'd do is just very briefly say some of the research we're doing. I'm a professor at RMIT, and I run a wellness program, which is an online Masters of Wellness program, where we actually teach yoga as part of the program. And it was actually just over 10 years ago when I moved from Monash University to RMIT, where I met Raju for the first time. Raju used to run the Vivekananda Yoga Centre in Brunswick. And along with Raju came to speak to me about research, and he had one of his students, Stephen Penman, with him, who was talking about research. And they said, what is the best research we can do with yoga? And at the time, we talked a little bit about doing clinical trials with yoga, maybe yoga for asthma or yoga for different conditions, and I sort of said, well, we don't really know what people do in Australia with yoga. In India, in America, there's quite a few yoga studies, but in Australia, what do people actually do? Is it asana practice? Is it pranayama practice? How much time do they spend in meditation? And that actually became the Yoga in Australia study, which some of you may have participated in, which Stephen Penman did as his master's project, and it's just recently published this year in the International Journal of Yoga. And that's available online, you can read the results. Well, we had over 4,000 people in Australia, yoga practitioners, students and teachers, fill out a survey, which took over an hour to fill out. Very, very detailed about which lineage they practice, how much they practice, what benefits, what complications. Very, very detailed survey. And that was really trying to create the context and the picture for what yoga is in Australia. And since then I've had a couple of other PhD students do yoga research. One's just finished this year, Jonathan Halpern, who did research in yoga and insomnia in the elderly. He actually did a clinical trial where he did objective sleep studies and wired up people's brains and measured their sleep over a 12-week period and had people doing yoga or just doing weight and loose control, and found that yoga, which was a very modified, very integrated practice which involved a lot of yoga nidra, so not so much asana, but there were asanas, and he did not use pranayama because there were yoga naive people and there wasn't with only an instruction a couple of times a week in a home CD. So it was mainly yoga nidra and some modified asana practice. He found that yoga was effective in improving insomnia in elderly people. And then I've got a couple of PhD students now who are actively involved in some research and some data that we've just got in, which we haven't published yet, which I thought I'd talk to you about being on non-communicable diseases, is yoga for metabolic syndrome. And this is one of my students, Anupama Tyagi, who did a Master's of Yoga Studies in India, came to Australia. She's working with me at RMIT, but she actually went to Haridwar with Shirley Tellies, who's maybe known to some of you, and in her lab, she looked at metabolic rate, oxygen consumption in people who had metabolic syndrome, in normal healthy people, and in advanced yoga practitioners. And she found so we haven't published this data, so it's just preliminary, but what she found was at rest, the yoga practitioners had much lower metabolic rate than the people with metabolic syndrome, which was statistically different. Which is suggesting that people who have metabolic syndrome, and in fact you'd expect that, because people with metabolic syndrome have high blood pressure, have high cholesterol, they have obesity, and they have glucose dysregulation. So you'd expect with high blood pressure and obesity that their hearts will be working harder, and even at rest, that they'd be using more oxygen to be stable at rest. And then what she did, she stressed these people, and she stressed them both mentally and physically. So mentally she made them do mental arithmetic, and she found that just by doing mental arithmetic, the oxygen consumption, the metabolic rate in all groups went up. But with the yoga practitioners, the oxygen rate went up when they were doing mental arithmetic, and it went straight back down. They recovered very rapidly, and they recovered back to the levels where they were at rest. With the healthy people, they went up, they didn't come down quite as fast, and they didn't recover as completely as the yoga practitioners. And the people with metabolic syndrome had much less recovery, and it was blunt. They stayed stressed, basically. And then she did another study where she made them do different pranayamas, so also physically stressing. So they did some Kapalabhati, and then they did some meditation. And again, the metabolic syndrome patients They had a high level of oxygen consumption and metabolism when they were stressed, and much blunted recovery. And practitioners were able to increase. I mean, they were able to do a couple of RTs, 100 breaths per minute, and then which raised their oxygen consumption very high. And then afterwards, they were able to actually come right back down when they were meditating. They were having oxygen consumption levels either at or below the rest levels. And I mean, that was a very preliminary study. It hasn't actually been researched before. And that sets up the study to say, well, if we give metabolic syndrome patients yoga practices, will that improve their metabolism? And just to give you a context, metabolic syndrome is about 25% or 30% of the Australian population and of the Indian population, and also most Western countries, the US as well. So it's a massive problem. It's pre-diabetes, but they call it the deadly quartet of high blood pressure, high cholesterol, glucose dysregulation, and central obesity. And these people go on to have higher mortality, huge burden to the health system, and it's likely that some simple yoga practices will improve them and basically train their metabolism to be more efficient. And certainly this study that we've just done suggests that people who do yoga for a long time have a much more efficient metabolism. You probably know that from your own experience. So when you do yoga, doesn't mean you can't be very active. In fact, you're probably more active and stress your body more, but then you recover much more quickly, and you can achieve a much deeper relaxation and a much deeper rest and recovery than people who haven't got that practice. So that's just a very quick snapshot of some of the research we've been doing and are doing. Continue to do yoga research. I've still got a couple of PhD students working on yoga, and now we're also working on some research into Ayurvedic Panchakarma. So we're looking at detoxification, purification, looking at environmental chemicals. That's also another big issue with environmental toxicity and its effect on different chronic disease, and whether we can remove that toxicity using Panchakarma practices, which is probably the most sophisticated detox knowledge we have out of any traditional form of medicine. Ayurvedic medicine has a very sophisticated knowledge of detoxification pathways and processes. So it's never really been fully studied where the toxins have been measured before and after, comparing health benefits before and after. So that's some of the research we continue to do. I continue to have links in India. I was just saying to Dr Nagendra, I'll be in India 3 times, 3 separate trips in the next 3 months. So I'm going for a week every month. So backwards and forwards from India quite a lot. Actively involved with yoga and teaching it for our Masters of Wellness program. So thank you for the opportunity to come and share what I'm doing. I'm happy to take any questions.